The Medical Research Council of the Gambia at the London School of Hygiene and Tropical Medicine with support from data.org on Monday hosted the third annual summit of Epiverse Trace at the Dawda Kairaba Jawara Conference Center in Bijilo. The theme for this year's summit was strengthening sustainable and inclusive analytics ecosystem of epidemic preparedness. JARJU has more.
The summit was aimed at providing an opportunity for constructive discussions around the implementation of Phase 2 of the Epiverse Trace project. It also provided the platform for reviews and feedbacks to strengthen the proposal for the Phase 2 roadmap. Speaking during the opening ceremony of the summit, the Minister of Health, Dr. Ahmadulamin Samate, highlighted the significance of the summit to the development of data analytic tools for pandemic preparedness.
The memories of COVID-19, the COVID-19 pandemic are still fresh in our minds. The world may experience another pandemic in the future. We need to have the tools and processes ready for the next pandemic. This is why what Epiverse is doing is so important. During the COVID-19 pandemic, it was clear to us that we needed to have data, but also to be able to analyze the data to make informed decisions about types of interventions the government can make, for instance.
Minister Samate explained that Epiverse analytic tools also aim to empower the health ministry staff to conduct the analysis, aligning with the Gambia government's plan to digitalize the health sector.
Development, training, and community building components is very innovative. I understand that some units of our ministry benefited from the pre-summit training you recently conducted. I commend this and the engagements the MRC Gambia Epiverse Trace team is having with staff of the ministry, especially the internships they are running for our staff. These internships give them training in R and the Epiverse Trace tools. This will no doubt improve data and analytics skills in the ministry, but also give us the opportunity to become contributing members of the Epiverse community.
With support from data.org, the Epiverse Trace project has made substantial progress towards producing analytic tools aimed at addressing critical questions during the epidemic. Uyi Stewart, PhD Chief Data and Technology Officer, gave an overview of data.org, which he said aims to address data challenges.
Data.org is a global non-profit. We have one mission, and our mission is to accelerate the power of data and AI to address pressing challenges. We think globally, but we work locally.
Dr. Davis Nwakama, Chief Operating Officer, MRC Gambia, also emphasized the importance of this summit, which he said was held as part of precautions to save more lives during epidemics.
When you do research, the ultimate purpose is to be able to translate that to health impact. And when we are in this arena of global health research, tools like this that help us not only track epidemics, but also respond to them, develop tools that can lead to intervention, particularly quick intervention. Because what we learned from COVID pandemic was really that it's no use finding the variant after it has established.
The Epiverse Trace Summit brought together distinguished guests from the Medical Research Council Unit, Ministry of Health, World Health Organization, and research bodies. Meanwhile, Epiverse Trace is part of Data.org initiative. This global collaborative initiative aims to develop a trustworthy data analysis ecosystem dedicated to getting ahead of the next public health crisis. Reporting for Star TV News, I am JARJU.